So, good morning, friends. Today we are talking about access cavity equation. First, the following contain introduction, components of root canal system, anatomy of apical third, canal configuration, isthmus, C-shaped canal, then preparation for access cavity, preparation and rules and objective of access cavity. So, first we are talking about then principle of access cavity preparation, instrument, anatomic law, aids of locate and canal orifices, individual tooth access cavity preparation, tips for access cavity preparation, access related mishaps, conclusion and reference. So first introduction. Access cavity preparation is first and most arguable phase of root canal therapy. Only understanding basic principle of access cavity preparation can lead to successful root canal treatment. To achieve optimal access cavity preparation, three factors must be considered. First, knowledge of morphology of root canal system. Second, pulp chamber size and shape. Third, number of root canal positions and curvatures. Next one is components of root canal system. The entire space in the dentine where the pulp is housed is called the root canal system. Root canal system is divided into two portions. First, the pulp chamber located in anatomical crown. Second, the pulp or root canal found in anatomical root. So next is see the diagram. This is normal anatomy of tooth, enamel, dentine, pulp, cementum, periodontal ligament, nerves and blood supply, root. This one is crown portion, this is the root portion. So सबसे पहले एक्सेस कैविटी प्रिपरेशन के लिए हमें टूथ के नट में जाना बहुत ज़्यादा ज़रूरी होता है. So next is pulp chamber. It occupies the corona portion of the pulp cavity and requires shape and size of the crown of tooth. The roof of the pulp chamber is formed by dentine. The floor merges into the root canal at the orifices. So, pulp found landmark occlusal to the pulp chamber, they tend to associate with the each cusp of posterior tooth and mesial and distal in anterior tooth. So, canal orifices opening is the in the floor of the pulp chamber leading into root canals. So root canal it extends from canal orifices to the apical foramen. See the diagram. This is pulp horn. Next, this is root canal orifices. This one, and this is furcation canal. This one. This is lateral canal. Okay, and this one is our apical foramen, and this one is apical delta. This is accessory foramina. So root canal system consists of pulp chamber or root canals. So this is very important कि हमें एनाटमी पता हो. So next one is but root canal. Extending the entire length of the root. नाम से समझ आ रहा है root canal है ना. Next is curvature में जो है वो है gradual curvature, sharp curvature, gradual curve with straight opening. And next is double curvature of S-shaped curvatures. ठीक है. So बोलते हैं bayonet canal. Next is curvature of canal can be measured by Robert method. Radius of the curvature is 2 since S. Their diagram. Next is lateral canals. It is a canal that is located at the approximately right angle to the main canal. This one is our main canal. अब उसके right angle पे जो भी canals present हैं, this is lateral canal. ठीक है, डायग्राम से समझ में आ रहा है. Next one is accessory canal. So lateral canals होता है, एक main canals होती है, एक accessory canal. Accessory canals are minute canals that extend in horizontal, vertical, lateral direction from the bulb to periodontium. In 73%, 73.5% cases in the apical third. So most commonly किसी भी RCT में रूट कैनाल किसी भी ट्रीटमेंट में फेलियर होता है वो इन कारणों से मेनली होता है जब हम एसेसरी कैनाल्स को नहीं पता लगा पाते हैं. Next one is in 11.4% case in the middle root and 15.1% case in the cervical third. So these canals contain connective tissue vessels which do not supply the pulp with a collateral circulation. They are formed by the entrapment of periodontal vessels in Herdwing epithelial root sheet during calcification. See the diagram. ठीक है. फिर फर्केशन कैनाल्स क्या होती है, नाम से समझ में आ रहा है जो फर्केशन के आसपास है. The accessory canal में occur in the bifurcation, trifurcation of multi-rooted teeth. ठीक है. और फिर next one is percussion canal formed as a result of entrapment of periodontal from fusion of diaphragm which become the pulp chamber floor. See the diagram? This is percussion canal. Then apical delta. What is apical delta? Y-shaped branching of the root canal near the apex. नाम समझ में आ रहा है apical के पास में ना apex के पास में जो है Y-shaped दिख रहा है this Y-shaped branching of the root canal near the apex. Okay. So see the diagram again. This one is apical foramen. This Y shape is apical delta. This is right angle to the main canal is lateral canal. This is near to bifurcation or trifurcation of the multi-threaded teeth is furcation canal. This is root canal orifices. This is pearl bond. This one and this one is our loop of pearl chamber. Next is anatomy of apical third. It is very important कि हमें anatomy पता हो. नहीं पता होता है तो फिर प्रॉब्लम शुरू होती है. According to Canada, the nearest diameter of the canal is defined not at the site of existing of the canal from the tooth, but usually occur within the dentist just prior to the initial layer of cementum. Minor diameter also called as apical constriction. कई बार सुना है ना apical constriction, apical constriction. So हम देखेंगे apical third mainly consists of apical constriction है ना. Next is cemento-dentinal junction and next one is apical foramen. अब डायग्राम से और अच्छे से समझेंगे हम. दिस इज अवर माइनर डायमीटर और अपाइकल कंस्ट्रक्शन जहाँ पे ये कंस्ट्रक्ट हो रहा है ये दिस पोर्शन. ठीक है. दिस इज माइनर डायमीटर और दिस इज मेजर डायमीटर इज अपाइकल फोरामिना. So shape between the minor and major diameter is funnel shape or it is also known as a morning glory. ये मोस्टली पीजीज के एग्जाम में पूछा जाता है. तो क्या होता है मॉर्निंग ग्लोरी. तो शेप बिटवीन द माइनर एंड द मेजर डायमीटर इज funnel shape or it is also as a morning glory. So distance क्या है 0.5 to 1.5 mm. The apical foramen is not always present in the anatomical apex, but it is deviated. Next is dermal classification of apical construction. So type A, type B, type C, type D. Type A में क्या होता है? It is a traditional single construction. This one is सिर्फ single construction present है. Type B में tapering construction. देखो ये taper होके जा रहा है पूरा. ये this one. Next is type C. मल्टी कंस्ट्रक्टर देखो जगह जगह दिख रहा है कंस्ट्रक्टेड एरिया दिख रहा है. सिंगल में सिर्फ एक ही जगह है. टाइप डी में क्या है पैरेलल कंस्ट्रक्शन बिल्कुल पैरेलल. सिंपल सी. नेक्स्ट इज क्रॉसमैन क्लासिफिकेशन. सीधा डायग्राम. नेक्स्ट इज लाइंस क्लासिफिकेशन. टाइप 1 टाइप 2 टाइप 3 टाइप 4 सिंगल दिस वन. फिर नेक्स्ट इज टाइप 1 टाइप 2 टाइप 3 टाइप 4 टाइप 5 Oh, sorry, classification. That is isthmus. So a ribbon-shaped internal canal connection or transverse anastomosis or corridor between two root canals. So first you can easily understand the word isthmus means किसी भी दो चीजों को जोड़ने वाला. So this is a corridor between two canals. ठीक है. जब भी कोई कैनाल को बीच से कोई चीज जोड़ रहा है, this is also known as isthmus. So, a ribbon-shaped intercanal connection or transverse anastomosis or corridor between two root canals. See the diagram? Type 1, type 2, type 3, type 4, type 5, type 6. This one. This one. Up. Next one is she-shaped canals. So, a single ribbon-shaped orifices with an arc of 180 degree or more, the most often mandibular second molar. या मैक्सिलरी फर्स्ट मोलर सबसे ज्यादा कहाँ मैंडिबुलर सेकंड मोलर में शीशे कैनाल और मैक्सिलरी फर्स्ट मोलर में कॉन्वेक्सिटी ऑफ कर्वेचर इज ऑलवेज ऑन वेस्टिबुलर साइड जो कॉन्वेक्सिटी ऑफ कर्वेचर इज ऑलवेज ऑन द वेस्टिबुलर साइड first discovered by Cook and Cox in 1979. It is also important for PG's exam. So next one is Melton's classification C1, C2, C3, C4, C5. The shape is an uninterrupted C with no separation or division. This one सिर्फ एक C टाइप की कैनाल है ये. So next is the canal shape resembles C2 में the canal shape resembles as a semicolon resulting from the discontinuation of a C outline, but either angle alpha or beta should be no less than 60 degree. Is less than no less than 60 degree. This is C2. In C3 serial diagram, two or three separate canals and both angles alpha and beta are less than 60 degree. इसमें क्या होगा? No less than 60 degree. इसमें less than 60 degree. So C4 is only one round or oval canal that is cross section. सिर्फ एक single round canal. Or next one is C5. No canal lumen can be observed, which is usually seen near the apex only. Simple. So next class is Fein's classification. See the diagram. The three-dimensional classification of C-shaped canal configuration. A is merging type. ये देखो पूरा merge हो गया है. दिख रहा है? B is symmetrical type. ये देखो. C is asymmetrical. ठीक है? So next is lingual and occlusal surface पे क्या होता है हम देखेंगे. So anxious cavity on the anterior teeth prepare on the lingual surface of the tooth. ठीक है. सबसे पहले anterior tooth के बारे में अपन बात करेंगे कि जो प्रिपेयर होती है वो lingual surface और anterior tooth पे अपन प्रिपेयर करेंगे. और जो posterior tooth में एक्सेस कैविटी रहेगी दिस इज प्रिपेयर ऑन द occlusal surface of the tooth. So, note some authors have recommended the traditional anterior access of the mandible incisor be moved from the lingual surface to incisor surface. So, next one is definition. What is access cavity? Access cavity is a cavity prepared in the crown of the tooth which expose the pulp chamber and provide a pathway to root canals. Thus, it is a part of mechanical operation of the tooth. सो क्या क्या रूल्स होने चाहिए इसके बारे में हम डिस्कस करेंगे. फर्स्ट इज द ऑब्जेक्टिव ऑफ एन एंट्री इज टू गिव डायरेक्ट एक्सेस टू द अपाइकल फोरम नॉट मल्टीपुलर कैनाल ओरिफिसेस. ठीक है. अंतर है इसमें. ये डिफरेंस है कि अपाइकल फोरम में अपन को डायरेक्ट एक्सेस चाहिए. नेक्स्ट वन इज एक्सेस कैविटी प्रिपरेशन आर डिफरेंट फ्रॉम टिपिकल ऑपरेटिव ऑक्लूजन प्रिपरेशन. ठीक है. समझ में आया ना? है ना कि जो अपन ऑपरेटिव ऑक्लूजन पे प्रिपरेशन करते हैं वो अलग होता है. एक्सेस कैविटी में प्रिपरेशन करना वो अलग होता है. द लाइकली anterior mapping of the tooth under treatment must be determined. When canals are difficult to find, the rubber dam should not be placed until the correct location has been confirmed. ये एक रूल है जब तक हमारी कैनाल हमें नहीं मिल जाती तब तक हमें रबर डैम को उस पर अप्लाई नहीं करना है. Next one is endodontic entries are prepared so the occlusolingual surface never so the proximal and gingival surface. ठीक है? As part of access preparation, the unsupported cusp of posterior teeth must be reduced. So this one also very important. जैसे हम शो करते हैं अनसपोर्टेड कस्प ऑफ द पोस्टीरियर टीथ है, तो उसको जरूर हमें रिड्यूस करना है. So next is ऑब्जेक्टिव ऑफ एक्सेस कैविटी पेशेंट. क्या ऑब्जेक्टिव है हमारे? ठीक है, रूल्स ऑल्सो वेरी इंपॉर्टेंट कि हमें रूल्स याद रखने हैं. नेक्स्ट इज टू अचीव फर्स्ट इज टू अचीव स्ट्रेट और डायरेक्ट लाइन एक्सेस टू अपाइका फोराmen or to the initial curvature of the canal. Second is to look at all root canal orifices. Third is the conserve surround tooth structure. So समझ में आ रहा है कि जो हमारा टूथ स्ट्रक्चर है वो बहुत इंपॉर्टेंट है. ठीक है, तो हमें उसे कंजर्व करके रखना है, एक्सेस में नहीं खोदना है हमें बिल्कुल. So principles of excess cultivation: first is outline form, convenience form, removal of remaining caries dentin, or toilet of cavity. First principle is outline form. The outline form of the endodontic cavity must be shaped and positioned that establishes complete access for the instrumentation from cavity margin to apical foramen. The external outline form evolves from the internal anatomy of the tooth established by the pulp, which means the internal anatomy of the pulp is projected in the form of outline form. Next is to achieve the to achieve optimal vibration, three factors of internal anatomy must be considered. First is size of the pulp chamber, second is shape of the pulp chamber, third one is the number of individual root canal and their curvature and their positions. So size of pulp chamber. सबसे पहले इसमें है द आउटलाइन फॉर्म इज the outline form is materially affected by the size of the pulse chamber. सबसे important. In the young patient, excess cavity are more extensive as pulse chamber and canal are large. The older patient, the pulse chamber reduced in all of the three dimension. ठीक है. Generally, the volume of the pulse chamber reduced in 50% in adults. The shape of the pulp chamber क्या है? शेप होना चाहिए. The finish outline form should accurately reflect the shape of the pulp chamber. For example, the pulp chamber the molar triangle should be triangular. The pulp chamber the molar is triangular, therefore the outline form should be triangular. The maxillary are oval shape, so elongated buccal lingually. Yeah. So the no positions curvature of number of positions and curvature of root canal in the older order to repair each canal efficiently without interference. The cavity walls often have to be extended to allow for an unstrained instrument approach to the apical foramen. The number of canals also determine the shape of the outline form. The outline form is materially affected with the cavity are extended to improve instrumentation. Principle 2 is convenience form. Convenience form में क्या आएगा? Modification of cavity outline from the established greater convenience in the placement of intracoronal restoration. When applied to endodontics, it means making the access cavity more convenient for the preparation filing of the root canal. So next is advantages. So uh, unobstructed access to the canal orifices, direct access to the apical foramen, cavity expansion of the accommodate filling technique, completely authority over the enlarging instrument. So next is shamrock preparation. Term by Luque done in a severely curved route or extra canals. Only that portion of the canal wall which is interfering has to be removed to free the instrument impingement. Otherwise, it conserves the advantage क्या it conserves two structures. So next is failure of the properly modify the access cavity outline the convenience will ultimately lead to failure by either root perforation, latch formation, instrument separation, or incorrect shape of the complete canal preparation. Often term है zipping. कभी कभी पूछ लेते हैं पीजीज में नीट पीजी में zipping क्या होता है. So principle थर्ड क्या है removal of the remaining carious dentin and defectives restoration. ठीक है the eliminate the mechanically as a many bacteria as possible from the interior of the tooth to eliminate the discolored tooth structure which may lead to staining of the crown and fracture help in locating orifices. So to eliminate any bacteria that in saliva is leaking into the prepared cavity to facilitate the good temporary save. If the tooth is sufficient weakened during removal of the defective restoration of access cavity exposed to saliva, recontamination restoration of the missing walls could be postponed until the completion of the radicular cavity operation, as this would allow greater access for the instrumentation. The cavity should, however, be isolated with the proper method before cleaning and shipping. तो कई बार क्या होता है कि हम जब एक्सेसरी प्रे करते हैं तो अगर कुछ डिफेक्टिव रेस्टोरेशन है या फिर केरियस पार्ट है तो हम उसे कभी कभी पूरा नहीं निकालते हैं. सो थोड़ा हमें स्ट्रेंथ मिलता है और अगर वो उसके बाद क्योंकि थोड़ा स्ट्रेंथ के लिए चाहिए होता है मेनली पूरा केरियस पार्ट कभी कभी नहीं निकालते हैं इन सम केसेस डिपेंड्स ऑन सिचुएशंस. Next is principle number 4, the toilet of the cavity. All the caries, debris, necrotic material must be removed from the chamber before the radicular preparation is begun. Calcific, metallic debris left in the chamber and carried into the canal may act as an obstruction during canal enlargement. So, see the diagram, long blade spoon excavator irrigation is done for the changing the chamber walls of the persistent debris. So first is regarding pulse chamber floor. क्या होता है इसमें relationship of pulse chamber to the clinical ground. First is law of centrality. ठीक है the floor of the pulse chamber is always in the center of the tooth at the CEJ level. बिल्कुल tooth के center में जो वो रहेगा pulse chamber रहेगा. सीधा diagram law of concentricity. ये laws बहुत important है. The walls of the pulse chamber are always concentric of to external surface of the crown at the level of the CEJ. देखो diagram में clear दिख रहा है. Next one is law of CEJ. The CEJ cemento-enamel junction is the most consistent, repeatable landmark for locating the position of the pulse chamber. ठीक है. So relationship root canal faces to the pulse chamber क्या क्या है? Law of symmetry. One. Except the maxillary molar orifices of the canals are equidistant from the line drawn in the mesodistal direction through the pulse chamber floor. देखो बिल्कुल इक्विडिस्टेंस है. अगर पल्प चैम्बर के फ्लोर से हम एक लाइन ड्रॉ करते हैं दिस वन तो क्या है सारे दोनों इक्विडिस्टेंस है बिल्कुल. ठीक है मीजो डिस्टल डायरेक्शन मीजो से डिस्टल में एक लाइन ड्रॉ करने के बाद जो दोनों अपने ओरिफाइसेस हैं वो एक ही डिस्टेंस में है इक्वल डिस्टेंस में है ना. सो सीधा रियल डायग्राम दिस वन एक एक मीजोबक्कल डिस्ट्रोबक्कल और दिस इज डिस्टल. Next is law of symmetry 2. Except for the maxillary molar, the orifices of the canal lie on the in line of perpendicular to the line draw the mesial distal direction across the center of the floor of the pulp chamber. ये देखो दोनों एक ही डायरेक्शन में है. दिस वन, ये देखो, ये देखो, है ना. ये लॉज हम सिमेट्री के याद रखेंगे तभी तो हमें अगर एक किरण मिल जाती है तो दूसरा फिर जल्दी मिल जाएगी. नेक्स्ट इज लॉ ऑफ कलर चेंज. The color of the pulp chamber floor is always darker than the walls. ठीक है, तो walls से darker होना चाहिए. Law of orifice location. The orifices of the root canal are always located at the junction of the walls and the floor. ठीक है, कहाँ मिलेगा? Junction of the walls and the floor के junction पे. ठीक है. Next one is law of orifice location 2. The orifices are located at the angles in the floor and wall junction. Next one is law of orifice location 3. The orifices of the root canal are located at the terminus of the root developmental fusion lines. तो इंस्ट्रूमेंट फॉर एक्सेस कैविटी ऑपरेशन, इंस्ट्रूमेंट क्या क्या है? फर्स्ट इज क्या क्या होना चाहिए? सो गुड मैग्नीफाइंग मिरर. आजकल एंटी फॉग मिरर आ गए हैं मार्केट में अवेलेबल. ठीक है, तो अगर पेशेंट्स को बार बार बोलना पड़ता है कि भैया नाक से सांस लीजिए, सर नाक से सांस लीजिए, नहीं पेशेंट अगर नहीं कर पा रहा है तो मार्केट में आजकल एडवांस चीज़ें आ गई जैसे एंटी फॉग मिरर. ज़्यादा महंगा नहीं आता है, 150 200 समथिंग आता है, बाकी बेटर देन ओल्डर वन. सो डायग्नोस्टिक इंस्ट्रूमेंट एंडोडोंटिक एक्सप्लोरर, एंडोडोंटिक एक्सकेवेटर, एक्सेस कैविटीज वर्स, gates, grid and drills, K files, small sizes, irrigation solution is series. So it's to look at the canal orifices, holding the entire map, staining the pulp chamber with the 1% methylene blue or carries discoloring solution, 6 stable 6 product. They are either red or green in color. So apply using micro brushes on the pulp chamber for 10 seconds. Rinse off. A small dot or groove leading to the orifice will be strained. ठीक है, इसमें बहुत यूजफुल है. स्टार्टिंग में हम अगर करें तो लोकेशन के लिए कैनाल्स की प्रॉपर इसमें अपन स्टेनिंग यूज कर सकते हैं जिसमें फर्स्ट 1% मिथाइलिन ब्लू यूज होता है. और नेक्स्ट इज परफॉर्मिंग द NOCL द क्या comparison do bubble test visualizing canal bedding points throughout throwing grooves with ultrasonic test translumination of the tooth using a fiber optic keeping the lights at the gingival level may be reveal the position of the canal orifices for the posterior teeth. So next, the for the posterior teeth is a canal located, but if it is not possible to decide which one, then an instrument is placed on the canal. Radiograph is taken. Identify can be using with the slow tool. Location of the canal faces. See the diagram. This is central incisor, lateral incisor, canine, premolar, second, first molar, second. This is what about maxillary. The maxillary तो this is mandibular tooth. So second canals बहुत रेयर तो नहीं, लेकिन हाँ फर्स्ट प्रीमोलर में दो कैनाल. इन सब में फर्स्ट में सेंट्रल में कभी दो, बाकी सब में सिंगल सिंगल कैनाल. लेटरल कैनाइन फर्स्ट प्रीमोलर सेकंड प्रीमोलर सिंगल सिंगल कैनाल. और फर्स्ट मैंडिबुलर मोलर में थ्री कैनाल, तो सेकंड मैंडिबुलर में तीन कैनाल. ठीक है, दिस इज मेसोबक्कल डिस्टल बक्कल डिस्टल कैनाल, मेसोबक्कल डिस्टल बक्कल डिस्टल कैनाल. फर्स्ट मोलर में चार कैनाल. ठीक है, दिस वन इज फोर कैनाल्स. तो सबसे पहले मैक्सिस सेंटर इंसाइडर एंड लेटर इंसाइडर की बात करें. लार्ज ट्रायंगुलर फॉर्नर शेप Coronal preparation is necessary to adequately debride the chimp of the pulp, remnant the bevel extension toward the incisor that will carry the preparation labially and thus nearer the central axis. Incisor extension allow the better access to large instrument and filling the material used in the apical third canal. जैसे canine में क्या होगा? Shape of the access cavity of canine is quite similar to the incisor canal. Incisor with the following difference: canine does not have a pulp on, or access cavity is oval in shape with a greater diameter labio-palatary. See the diagram. This is your see the diagram. See, this is dissection of see the diagram. This one. Okay. So यहाँ पे पल्प ऑन है और यहाँ पे पल्प ऑन नहीं। ओके। फिर एरर एंड एक्सेस कैलिब्रेशन मैक्सिमम में क्या क्या हो सकता है? क्या हो सकता है? परफोरेशन एट द लेबियो सर्वाइकल वॉल, है ना? फिर होता है अपना लेबियल वॉल डिस्टल वॉल में हो सकता है परफोरेशन। फिर नेक्स्ट इज पियर शेप प्रिपरेशन हो सकती है, डिसकलरेशन हो सकता है, लेस फॉर्मेशन हो सकता है और परफोरेशन ऑफ द अपाइकल डिस्टल कर्व and the ledge formation the apical label curve. So next is mandibular center and lateral incisor. Mandibular center and lateral incisor are similar in the shape of accessibility and the root canal system. So shape of the access cavity of the mandibular incisors in different maxillary incisors follow aspect. So it is similar in shape. Shape is long oval and great dimension directed incisogingivally. So mandibular canines में क्या होगा? यहाँ खत्म करते हैं. Next is mandibular canine. Shape of the access opening is a mandibular canine similar to the maxillary canine except that it is a smaller in size. Root canal outline is narrower in mesodistal dimension. Generally, two canals are present in mandibular canine. So, see the diagram. Okay, this one, this one. Urinary access calculation वही जो उसमें थे कि housing at the labials or at the wall, housing at the labial wall, housing at the distal or failure to explore the sorry failure to explore or fill the second canal or discoloration or less formation. See the देखो ये 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 देखो ये axillary premolar shape of the access cavity is wide, so in which boundary should not exist beyond half the lingual incline of the buccal cusp and half of the buccal incline the lingual cusp. For the second premolar, similar to the maxillary first premolar, varies only in the anatomic structure of the pulp chamber. See the diagram, which is our premolar. Okay, two canals present. This one. This mandibular single canal. ऐसे कैविटी ना maxillary preparation में क्या करोगे? Under extended preparation exposing only pulp horn, overextended preparation performing at the mesio-cervical indentation, faulty alignment of access cavity through full venous expression, broken instrument, failure to explore obstruent third canal. मैक्सी फर्स्ट मोलर में थर्ड कैनाल ऑब्जर्व नहीं हो पाती है और मैक्सी सेकंड प्रीमोलर में फेलियर टू एक्सप्लोर द ऑब्जर्व द सेकंड कैनाल. ठीक है. नेक्स्ट वन इज मैंडुलर फर्स्ट प्रीमोलर. Difference that are seen in the accessibility preparation of mandibular first premolar from the maxillary premolar area. There is a presence of 30-degree lingual inclination of the crown to the root as the starting point of the bud. The penetration should be halfway of the lingual incline of the buccal cusp on the line connecting the cusp tails. Shape of the cavity is oval, which is wider distally when compared with a maxillary counterpart. See the mandibular premolar. Single canal here. It is easy than maxillary premolar. So, this one. अगर two canals present भी है, this और canal mainly बहुत रेयर होता है कि मैंडिबुलर कैनाइ मैंडिबुलर प्रीमोलर्स में दो कैनाल्स रहे बहुत रेयर होता है फिर आता है second view. The access cavity is similar to mandibular first premolar, except the mandibular second premolar are the enamel penetration is initiated in the center group because its crown has a smaller lingual tilt. Smaller lingual tilt रहता है because a better left under lingual half. The lingual boundaries of the access cavity extend halfway up the lingual cusp incline. The pulp chamber is wider, but the root canal are more often than over. Then round, avoid excess opening is wider, mesodistally, this one. Okay. Here cavity preparation and mango premolar preparation perforation distal gingival wall incomplete preparation of the instrument breakage bifurcation of the canal completely missed apical perforation of the apical curvature. Maxillary first molar the shape of the pulse chamber is rhomboid. So palatal canal orifices is located palatally mesobuccal under the mesobuccal cusp and distal buccal. It's slightly distal palatal to the mesobuccal orifice. A line draw to connect the all three orifices mesobuccal, distal buccal, and palatal. From the triangle term as a molar triangle. Next one is almost always a second mesobuccal canal is MB2 is present in first maxillary molar. So locate palatal or mesial to the MB1. So जो अपनी mesobuccal canal है MB2 जो है वो MB1 के palatal and mesial present रहेगी. This one. See the diagram. ठीक है. This MB1 MB2. So because of the presence of MB2, the access cavity required rhomboid shape to corner corresponding to the all the canal faces in MB1. See the diagram. So next one is axillary second molar. So basic technique is similar to that the first molar, but the with following difference. First is three roots are found closer, which may even fuse to form a single root. Okay, then is MB2 is less likely to be present in second molar. The three canals forms a round triangle with the base to buccal. The mesobuccal orifices is located more towards mesial and buccal than in first molar. So the diagram. ठीक है अब फिर वही है कि एरर कौन कौन से आते हैं अंडर एक्सटेंड प्रिपरेशन ओवर एक्सटेंड प्रिपरेशन परफोरेशन इनटू फरका यूजिंग अ सर्जिकल लेंथ पर और inadequate vertical preparation फिर disoriented occlusal outline from exposing only the palatal canal ledge formation and perforation of the palatal. So next is mandibular first molar. The shape of the access cavity is usually trapezoidal in respective number of the canals present. Mesobuccal orifices into the under the mesobuccal cast, mesolingual in the depression formed by mesolingual wall, and the distal orifices oval in shape with the largest diameter buccal lingual located distal to the buccal groove. Here, next is orifices of all the canals are usually located in the mesial two-third of the crown. Cases have been reported in the extramesial canal. Middle mesial canal 1 to 50% lying in a developmental group between the mesobuccal and the mesolimbar canals. Distal roots has also to have a more than one orifice, distal buccal, distal lingual, middle distal. These orifices are usually joined by the developmental. See the diagram? Okay. So next is mandibular second molar. Access opening is mandibular second molar is similar to the first molar, except few difference. In the mandibular second molar, pulp chamber is smaller in size. One, two, or more canals may be present. Mesobuccal and mesolingual canal orifices are located closer together. When three canals are present, shape of the access preparation is almost similar to the mandibular first molar, but it is more triangular and less rhomboid shape. When two canal orifices are present, access cavity is rectangular, wide and mesostally and narrow buccal. फिर क्या एरर आएंगी देख ओवर एक्सटेंडेड प्रिपरेशन है परफोरेशन इनटू फर्टिलाइजिंग लॉन्गर बर्थ परफोरेशन द मीजियल cervical wall, disoriented occlusal outline, failure to find a second distal canal, ledge formation, perforation of the curved distal. Tips क्या है? This is very important. When the diagram shows the canal shadow suddenly stops, it is assumed the bifurcation or trifurcation into fine diameter triggered at this point. Whenever the outline of the root is unclear, has an unusual contour, or strays in any way to form the expected to radiograph appearance, and one should an additional root canal to radiograph from different angulation. ठीक है अलग अलग एंगुलेशन से हमको दो डायग्राम जो दो रेडियोग्राफ हमको लेना है फिर नेक्स्ट क्या लेटर रेडियोस इंडिकेट प्रेजेंस ऑफ द लेटर कैनाल्स और accessory canals knob like image indicate an apex that curve towards or away from the x-ray beam bullseye multiple vertical lines indicate thin root which may be a glass shape in the cross section, hence acceptable to the strips or the lateral profession. In a dark line, the apparent the coronal half parallel to the master instrument suspected canal. Here, ethnicity has the significant influence of the aberrant anatomy. The knowledge of curvature help in the cleaning shaping and when the inserted into the orifices opening will be reveal the direction that the canal takes in the leaving the pulp chamber. Tactile perception with the hand instrument can identify the curvature and obstruction of the additional canal orifices. So access radiated mission क्या missed canal. Mesial root of the maxillary molar. This is MB2. Okay. Mesial root of maxillary molar MB2. Distal root of the mandibular molar. ठीक है distal root of mandibular molar SS cavity with perforation undesirable communication per right angles to the tooth mesially drifted molar reconstruction correction crown fracture होता है fracture due to the tooth weaker addition by SS preparation small fracture fragment fracture extensive होता है फिर existing permanent restoration small restoration can occur to the surface class 2 amalgam only or defective restoration assess through full crown, carious leakage, under crown margin, undermined natural crown, rotated, misaligned the normal tooth position and arch configuration. Visibility is limited, porcelain to metal crown, fracture or craze line, large metallic deposit in a pulp chamber, treating the wrong tooth. Intention by in a tension by dentist, mark the tooth before rubber dam. So, access cavity operation is the first step towards successful root canal therapy. Knowledge of the pulp chamber and morphology, along with an examination of the pre-operative radiograph, should be uh, integrated when the designing the access cavity. Thus, care should be taken to minimize the error occurring during access cavity preparation, which leads to successful root canal. So, there is a reference, and thank you so much.